I'm going to be your nurse today. And what's your name?
Diana.
Diana? Great. When's your birthday?
12/28/85.
Okay. Is there anything concerning you today? Any problems that,
No.
are bothering you right now? No? Any headaches or dizziness lately?
No.
No? Okay. So what we're going to be examining today is your head, your neck, your eyes, your ears, your nose, and your throat. So we're just concerned about things like vision problems. Do you have any problems with eyesight?
Mm-hmm.
You do? Do you wear glasses or?
I wear contacts.
You do? And do you have them on right now?
Yes.
Okay. Any like hearing problems or?
No.
Nothing like that. Okay. So we'll start off by examining your head. Okay. We're just gonna feel for any lesion, any bumps, and symmetry. Okay, in your skull. Any tenderness when I'm touching your head?
Mm-mm.
Okay. All right. Your scalp looks nice and healthy. There's no flaking. I don't see any lesions. No redness or sores. That's good. Okay. And so we're going to check your facial symmetry. So we're going to need you to take a big smile for us and then frown. Okay. And can you lift your eyebrows? Okay, good. And everything looks symmetrical and there's no facial drooping or anything like that, so that's good. So next we're just going to be checking your sinuses. So I'm going to be touching your face. My fingers might be a little bit cold, so just let me know if it hurts or anything when I press down lightly on your sinuses, okay?
Mm-hmm.
Any pain there?
No.
Okay, and up here?
Mm-mm.
Okay, good. And next, we're going to be checking your sensation to the face. So I have a Q-tip here. And this is going to be the dull side, so it feels like this.
Mm-hmm.
And this is going to be the sharp side, and it feels like that. Okay? So we just need you to close your eyes. I'm going to touch a part of your face, and you tell me if you feel dull or sharp, okay?
Mm-hmm. Dull.
Great.
Sharp.
Okay.
Dull.
Great. And one more time here.
Sharp.
Good. All right, so next we're going to be looking at the strength of your sternocleidomastoid muscles. And so basically I'm going to be pressing down on your shoulders here and then lift up against my pressure there. Good. All right, so nice and strong there. And next, we're going to be looking at your neck symmetry. So right now, just looking at you, your neck looks nice and symmetrical, nice and straight and even there. I'm going to be feeling for your trachea, making sure it's midline, okay? And your thyroid here. So it looks like it's nice and healthy, not enlarged, okay? Next, I'm just going to be feeling for your lymph nodes, okay? Making sure that it's not painful when I press down, and then there's no swelling of the lymph nodes, okay? All right, great. And while I'm here, I'm just going to be feeling for your carotid artery. Nice strong pulse. Great. All right, so we're going to be checking for your swallow reflex. So can you swallow? Any problems with that? Any sore throat or anything? No. Okay, great. And so we're going to be looking over your eyes next. So you do have your contacts on, right?
Correct.
Okay. And so what we're going to check for first is your pupillary response. So I'm going to be shining a light using this tool here, this equipment. And I'm just going to be looking for constriction evenly on both sides, okay?
Okay.
So go ahead and look straight up at me. Good. Other side. All right. Looks like your both eyes are constricting at the same time evenly and reacting to the light. So I just want you to follow this tool here, and then we're going to test your vision, how you can follow here. And straight ahead. Okay? Did that bother you at all, or is everything fine with that?
Everything was fine.
Okay. And next, we're going to be checking your lacrimal glands, making sure there's no drainage and everything looks healthy. Your conjunctiva look nice and healthy here. Red, no drainage. Light pink. Okay, good. And next, we're going to be checking your eyes. I'm just going to be looking for any like ulcers or scratches, that kind of thing, okay? So go ahead and look straight at me. Okay, it looks nice and healthy there. Next, we're going to be checking for any problems with your vision. So I'm just going to hold up a couple fingers and you tell me how many I'm holding up, okay?
Okay. 3.
Okay, good. And then we're going to check your field of vision. So just let me know when you start seeing my fingers here, okay?
3.
Okay, on the other side.
3.
Okay, good. All right, next we're going to be checking your ears. So I'm going to be looking inside your ears, checking for any cerumen, which is like earwax buildup, the health of your tympanic membrane, just make sure it's intact, or any like indication of infection like drainage, okay?
Okay.
All right, so I'm going to pull on your ear a little bit just to make sure there's no tenderness there, and just let me know if it hurts, okay?
Okay.
Does that hurt?
No.
Okay. Okay, it looks nice and healthy. Your ear canal is clear, your tympanic membrane is intact, no drainage, no redness or swelling in that one. So we're going to look for the same thing on this side. Okay, great, nice and healthy. Any tenderness on that side?
No.
All right. And so we're going to just test real quick. I'm going to do a whisper test, okay? So I'm going to step aside and I'm going to whisper a word and you tell me what I just said, okay?
Okay.
All right.
Apple.
Okay, great. Other side.
Orange.
Great. All right, so your ears are nice and healthy, sounds like. And what we're going to do next is check your nose. So we're going to be looking for symmetry, and just by looking at it, it looks nice and straight. Your nose is aligned there. Any tenderness there?
Mm-mm.
No? Okay, so before I take a look inside your nose, we're going to do a little smell test, okay?
Okay.
So I want you to close your eyes and then cover one nose. And I'm going to have you smell something and you tell me what you think you're smelling, okay?
Vanilla.
Right. So we'll try the other side. You smell that?
Sriracha.
That's right. Okay, great. So let me take a look inside your nose. We're going to use the same tool here. And I'm just going to be looking for any lesions, any redness, making sure your turbinates are nice and healthy, which they look like they are. Nice and pink, moist. No lesions. Great. All right, so now we're going to take a look inside your mouth. Make sure everything is nice and healthy in there. We're going to look for any lesions, any drainage. We're going to look at your throat, make sure it's nice and healthy, and without exudate or anything like that. So let's just take a look. Go ahead and say ah.
Oh.
All right, your uvula is nice and midline. Your tonsils are healthy, not swollen. No lesions. Your hard palate looks nice and healthy. And teeth look healthy. Gums. Any bleeding that you've noticed?
Mm-mm.
No? Okay. Any sensitivity when you're chewing or drinking hot or cold liquids?
No.
Okay. And so that looks nice and healthy in there. Any problems with soreness in your throat? Okay. All right, so it looks like we have examined your head, neck, and throat, along with your eyes, ears, and nose, and everything looks to be healthy. I just want to check one last thing, make sure your jaw mandibular joint is okay. So can you open your mouth and then clench your teeth? Okay, all right, great. So that concludes our exam. Do you have any other questions or concerns?
No.
All right, thank you.
Thank you.